In this video, this is a continuation video. Let us discuss about clinical types of hypermetropia. There are 4 clinical types. They are congenital, pathological, simple, and secondary. Congenital hypermetropia. Presence of anisometropia due to one abnormal small eye causes congenital hypermetropia. This condition occurs since birth. The child is born with one abnormal small eye, because of which anisometropia occurs, which means having different refractive index of both eyes. Obviously, there is a difference in refractive index in normal eye. There will be one refractive index and there will be decreased refractive index in small eye. This causes anisometropia and congenital hypermetropia, which causes blurred vision. Of course, the child cannot tell you that, but it causes hypermetropia. And the second one is simple hypermetropia. It is due to biological variations in the development of eyeball and may occur as axial curvature hypermetropia. To know more about axial curvature hypermetropia or why small eye causes hypermetropia, small eye, what is meant by small eye? Small eye means decreased anterior-posterior length of eye. This is known as anteroposterior length, the distance between cornea, the first layer, and the retina. Cornea and the retina is known as anteroposterior length of eye. And the decreased anteroposterior length is known as small eye. To know about all of them more, watch our first video. On the topic, errors of refraction and etiology of hypermetropia has been discussed in that video. So let us now discuss about pathological hypermetropia. Abnormal development of eye in conditions like microphthalmos, nanophthalmos, microcornea, congenital posterior subluxation of lens, and congenital aphakia causes pathological hypermetropia. Secondary hypermetropia due to other eye disorders resulting in hypermetropia. Example, index hypermetropia. These are all topics we discussed in our first video. Clinical features, symptoms. Asymptomatic in young patients can be corrected by accommodative effort. What is meant by accommodative effort? Like we all might did that once, like closing our eyelids and what we all do when we are in a mountain and watch things at the plane level, like closing our eyelids, constriction of eyelid. The accommodative effort is nothing but when we try to identify an object, to view an object, those all, what we all do at the time is known as accommodative effort. And in asymptomatic young patients, they can see an object by accommodative effort. Asthenopic symptoms with normal vision. They are tiredness, mild photophobia, headache. Defective vision with asthenopic symptoms. Defective vision only. These are all symptoms. Let us see the signs. So now the symptoms are nothing but what we all say to the doctor. The signs are what doctor sees in us. So the signs are small eyeball or cornea, shallow anterior chamber, retinoscopy, autorefractometry reveal hypermetropic refractive error. Retinoscopy is a device, and on fundus examination, the doctor can see small optic disc. A scan reveals short anteroposterior length of eyeball in axial hypermetropia. What are all the complications of hypermetropia are? Let us see now. Recurrent styes, blepharitis, chalasia. These are all diseases of eyelids. And convergent squint may develop in children. Amblyopia may develop, or hypermetropia is a predisposition to primary narrow angle glaucoma. And investigations that are required to diagnose a hypermetropic patient is cycloplegic retinoscopy, autorefractometry, and a scan. Treatment for hypermetropia are optical and surgical. Optically, we can correct an hypermetropic eye with convex lens, that is plus lens. Surgically, we can correct either cornea or lens to converge all the light rays on retina. So the corneal correction involves dermal laser keratopathy by using YAG laser, and conductive keratopathy by shrinking the collagen through radiofrequency, and hyperopic photorefractive keratectomy by corneal stroma is corrected in this hyperopic photorefractive keratectomy by photoablating the corneal stroma using UV flash. So we are removing the cornea using UV flash. And hyperopic LASIK. Hyperopic LASIK is a popular surgery. Everyone, after attaining a certain age, they will try to get this surgery done. That is hyperopic LASIK surgery. It involves stromal ablation in peripheral cornea. What is meant by LASIK? LASIK means laser assisted in situ keratomeliasis. So all these corneal surgeries, what they will do is they will make the cornea curve, and steepening of cornea will occur in all these surgeries, either by removing the cornea, such as hyperopic photorefractive keratectomy, and either by collagen shrinkage, such as conductive keratoplasty. And coming to lens, we can correct the refractive error of hypermetropia by correcting lens by implanting a implantable contact lens and refractive lens exchange in presbyopic eye. These are all the treatment options of hypermetropia. Thank you.